Hey YouTube, today my second video on pharmacology will be on caffeine. So there's a caffeine molecule shown there as adenosine, dopamine, and noradrenaline or norepinephrine. Sorry if I pronounced it wrong. I think caffeine inhibits adenosine in the brain, which in turn produces dopamine and noradrenaline. So let's get started with the way caffeine and adenosine. I think adenosine is a chemical that the brain releases when the body needs to slow down nerve selectivity. In other words, it is a natural sedative that reminds us we need to rest or sleep. So when we consume caffeine, it blocks adenosine and tricks the body into feeling awake. So yeah, that's basically the way adenosine works. So caffeine blocks adenosine. Now off to dopamine. Dopamine is a neurotransmitter in the brain that stimulates a sense of pleasure, as well as attention and motivation. Caffeine, although with a much lesser effect, increases dopamine levels the same way recreational drugs such as amphetamines and cocaine do. That is why people feel revived and alert after drinking caffeinated beverages, and why it can also develop into an addiction. And noradrenaline, personally I don't really know much about this molecule, but I think it's a stress chemical released when you're stressed. Yeah, like I said, I didn't really know much about it. Yeah, that's all I think I know about it. Yeah, it's produced in the brain when you're stressed. So that's the second video on pharmacology. Please stay tuned for the next video. I'm not quite sure what it'll be on. Feel free to comment what you reckon the next video should be on, and the first one to comment, I'll do a pharmacology video on what they recommend. So yeah, please subscribe, rate and comment.